today we're going to talk about HIV prevention. One very effective weapon that we have in our arsenal for HIV prevention, and that's still the good old-fashioned condom. Condom is a barrier method of prevention. It creates an artificial barrier to prevent the transmission of bodily fluids which could contain HIV. Most of the time where condoms fail, it's because they're not being used properly. Either people aren't putting them on correctly, or they're using the wrong type of lubricant for that type of condom. But used effectively, it's a really effective barrier method to prevent the transmission of HIV. However, we also have other methods that we can use to prevent HIV, but to understand these we need to understand a little bit about the treatments for HIV. Nowadays we have very effective treatments, a group of drugs called antiretroviral therapy or highly active antiretroviral therapy, often referred to as ART or HAART. These are a group of medications that fight how HIV replicates on a cellular level, thereby dampening the effects of the virus within an infected person's system, reducing the amount of free virus within their system, and allowing their immune system to some degree recover and stay healthy. And it reduces the amount of free virus in their system, therefore they're not as infectious to other people. Now this is important when we're considering HIV prevention, because there are two types of prevention that use anti-HIV drugs. The first is called post-exposure prophylaxis, or PEP for short. Post-exposure prophylaxis treatment is when you take a combination of the anti-HIV medication after you may have been at risk of exposure to HIV. So you've had sex with someone and the condom broke and they've come inside you. You may not know the HIV status of that individual, or you may actually know that they are HIV positive and therefore you feel that you have been at risk of becoming infected. In these circumstances, if you access the post-exposure prophylaxis, or PEP, within 72 hours, it may more than likely be effective at actually preventing the HIV from taking hold in your system. And PEP is available for most larger sexual health centres and out of hours from larger accident and emergency departments. But if you're stuck, call the NHS 111 number and they'll be able to advise you of your nearest centre that will be offering PEP treatment. The other thing that you may have read about or seen about, particularly in the gay press or the mainstream media, is a thing called pre-exposure prophylaxis, or PrEP. And this is a theory that, again, if you take an anti-HIV treatment, in this case we're talking about a particular treatment, a once-a-day tablet called Truvada. If you take this on a daily basis, it may actually prevent you catching HIV if you happen to engage in risky sexual activity. In the UK, we don't actually have a licence for Truvada to be used in this way. It is used as an anti-HIV medicine, but in combination with other medicines and drugs. In the US, since 2012, it has been licensed for use as a pre-exposure prophylaxis in patients, in two certain groups of patients, men who have sex with men, and also serodiscordant heterosexual couples. So that's where one has the virus and the other one doesn't. The problems with this particular drug are in the long-term use. It's been shown to have some effects on the liver and can cause an inflammation of the liver, and also one of the other commonly reported side effects is what we call lactic acidosis, or build-up of acid in the blood. It's also not licensed for use in people who have chronic hepatitis B. It is only prescribed on a PrEP regime where other conditions are adhered to, and that includes the patients who've been prescribed the PrEP medication having to ensure that they are HIV negative before they're prescribed the medicine, and then agreeing to be tested every 3 months to ensure that they remain negative. They also have to agree to counselling and to adhering to safer sex practices, so an agreement that they are going to try and maintain safer sex behaviours and use a condom. In the UK, as I've said, this particular medication is not licensed for use, but we do know that some people have been buying it via the internet and may be using it. The risks with using Truvada when you're not being monitored by a physician or a healthcare professional are that you may not be monitored for any of the potential side effects, and also that if you don't adhere to taking the medication properly, you could ultimately develop a resistance. Even just missing 1 or 2 doses of medication means that the HIV, if you've been exposed, may actually become resistant to this medication. Which takes us therefore full circle back to our main form of protection, which is the condom. You want to get hold of condoms. They're freely available from most NHS clinics, your GP, some venues such as saunas, bars and clubs, and they are also available to buy in shops, so you can get them usually from even your corner convenience store will sell them, but if you want them for free, you can obtain them from an NHS sexual health clinic. So tune in next time, where we're going to look at a little bit more on HIV treatments, but also some of the research that's being done to look towards a cure for HIV. So tune in next week. Until then, take care, and remember, always use a condom.